Case of hypertensive cardiomyopathy because of renal artery stenosis, most likely muscular dysplasia is the cause of this stenosis because the patient is only child. So in this case, what you see, this image, this is aorta and this is right renal artery. This is a proximal ostial portion, this is proximal portion, and this is inferior vena cava, and right renal artery passes just posterior to inferior vena cava. This portion is right side and this portion is left side. So this is right renal artery stenosis. You can see that most turbulent part here, color wise you can see, because case came to us for echocardiography. We found hypertensive cardiomyopathy at the young age, so I tried to find out what is the cause of this hypertension. So finally I found renal muscular dysplasia, the cause of renal artery stenosis and cause of hypertensive cardiomyopathy. This is next image. You can see this is thickened left ventricular wall and mild global hypokinesia. Ejection fraction is almost 50%. Again the same thing. This is abdominal aorta at the level of renal artery, and this is ostial portion, and then you don't find obstruction. Main obstruction lies in the proximal part, not at the ostium. You see there. Here most obstruction, most and highest part of obstruction is here. You can see easily here. Next image is the same thing. Only thing you have to know, in case of atherosclerotic obstruction, ostium is the most common part of the obstruction. In case of muscular dysplasia, ostium is spared. The other part, this part, proximal part or mid part, is the part where you will get the most obstruction. You can see easily. This is the part that has got highest obstruction compared to this ostial portion. This is ostial portion, this is the proximal portion. If you divide renal artery in ostial, proximal, mid and distal, then it will be the proximal part. Proximal to mid part has got the highest obstruction. You see the velocity scale. Velocity is in the renal artery is peak velocity is 4 meter, more than 4 meter per second, that is 471 centimeter per second. Peak guidance 89 and velocity, the minimum velocity is 323 centimeter per second and guidance is 42. Here the velocity is important. Just want to go to see renal criteria of renal artery stenosis. You can see the peak systolic velocity. If peak systolic velocity is more than 180 centimeter per second, that is in favor of renal artery stenosis. So here the velocity is more than 400. So renal artery aortic ratio, the ratio of peak systolic velocity in renal artery compared to that of aorta at the same level, typically greater than 3.5 is the criteria for renal artery stenosis. Third and fourth criteria for is for vessel that is present in renal parenchyma, acceleration time and acceleration index. Acceleration time means how much time it takes to accelerate, to take the highest velocity, the peak velocity. If that takes more than 70 millisecond and acceleration index is less than 300 centimeter per second, so acceleration time is more than 70 millisecond and acceleration index is less than 3 meter per second square, that you will get in the renal. Basically in this part, you can see here the part, this part, in this part, if you get this thing, acceleration time and acceleration index, then you will call it renal artery stenosis. Turbulent flow in post-stenotic area, even stenotic area also. Resistive index, the part which is affected has got less resistive index. So whenever you find resistive index discrepancies, the kidney which has got less resistive index has renal artery stenosis. Other imaging techniques by using Doppler CT angiography and MRI angiography you can visualize the stenosis directly. So these are the criteria to find out renal artery stenosis: peak systolic velocity, renal artery and aortic velocity, peak velocity ratio, acceleration time and acceleration index, that you find in the mainly in the arteries present in the kidney. Turbulent flow you find at the stenotic area, stenotic jet and posterior jet. Resistive index you can find again in the renal parenchyma, where you will find less resistive index. Even you can find on renal artery also resistive index. And CT angiography, MRI angiography will confirm all these things. So we have come to, in this image you can see the all 4 chambers are prominent in size or mildly enlarged, you can say. LV wall thickness is very significant, and at the same time mild global hypokinesia. Again the same thing, this is aorta, this is the renal artery, right renal artery. This part is the most stenotic part. You can see the thick, this is not uniform. If you want to see, stenosis is not uniform. It is beaded. You see here the beaded form here. So this is narrow form, then it's dilated form. That is what indicates it is fibromuscular dysplasia. So this is the case of renal artery fibromuscular dysplasia, because the lumen is not uniform. You see here in case of very high velocity, you have to reduce you have to increase the velocity scale. You see the velocity scale 154 centimeter per second. So velocity scale is very high in this case, to find out whether the flow is not uniform or not uniform. It means the size of this turbulent, you see here it is dilated, here it is narrow. If you decrease the velocity scale, you will not find all these things. So you have to increase the velocity is high, then increase the scale. If velocity is low, decrease the scale, because you have to find the low velocity, then scale should be low. If velocity is very high, then scale should be also high. So in this case our scale is 154 centimeter per second. You can see the 154 centimeter per second. Only that, then you can see this thing, that is this part is little bit dilatation. So it is not uniform, it is beaded form, you say. So beaded form means what? This is fibromuscular dysplasia. You can see the beaded form. Beaded form. Beaded form. You see the beaded form. That is what indicates fibromuscular dysplasia. Again, next thing is same thing. Left ventricle, left atrium, left ventricle and aorta. This is parasternal long axis view. Again, this is the only banana peel view of renal artery. This is right renal artery. You can see the turbulence here. I want to see beaded form. See, this is not uniform. See, you can see. So this is the case of fibromuscular dysplasia. Again, you see the velocity is quite high, characterized by less than 180 centimeter per second goes in favor normal, but more than 180 centimeter per second is in the favor of renal artery stenosis, where the peak velocity is almost 3 meter per second. The ultimate thing is that whenever you find hypertensive cardiomyopathy like pictured in young age, then try to find out renal artery stenosis as the cause. Thank you.